Oh, sure. Sim, you can unmute yourself, please.
Yeah. I have another, instead of typing the question.
Yeah.
Somebody with kidney cancer
Yeah.
and retinitis pigmentosa, like Daniel.
Okay.
Okay, the cancer was very sudden. I mean, didn't expect
Right.
it. And then, so started on X39 and Eon. And he's also doing immunotherapy in the hospital in Singapore. Okay.
Right.
My question is, after using for a few months, should we
Yeah.
add any patches?
Okay, so if after using for a few months, right, if everything getting better,
Yep.
so now my strategy is to add on with Alavida.
Okay, on the forehead.
On the forehead or even below the belly button,
Okay.
whichever she feel comfortable. So she can try and error about this. So the reason now I start to talk about Alavida is because Alavida can really regulate a lot of organs and hormone function,
Okay.
and it can be a good way for the body to learn to detox all over the organ.
Okay.
Right.
All right. I'll let them know.
Yeah. So for this friend of yours, how long he or she has been using?
2 months. 2 months.
2 months. So
they bought the 4-month package, so
right.
he was used for 2 months.
Right.
And he also doing immunotherapy in the hospital, and apparently the doctor is quite impressed with the results overall.
Right.
He is continuing with the immunotherapy. I asked him
Right.
how long that is going to be. Is it like a fixed number of sessions, or is it like, perpetual?
Immunotherapy immunotherapy normally could take quite long, at least a year or so.
I actually told them, instead of immunotherapy, why don't you use glutathione?
Right.
But
And
I guess they wanted the doctor in the picture.
I see.
So yeah, but then the wife is also very concerned about his RP, retinitis pigmentosa.
Right.
Is it possible to add carnosine for him after the 3rd month?
Can. So
right, on
okay,
the forehead, right?
right. So the most important thing is after immunotherapy, right? So even like chemo and radio, the most thing that the thing that we worry the most is always the appetite getting worse.
Oh,
So
I did ask that question.
Yeah.
Sleeping well and his appetite is good, which is
Wow,
fantastic. So I was very happy to hear that.
Okay, good.
Yeah.
In any cases, maybe a few months later, because if she keep continue to immunotherapy, right, they will come to the point that it's a breaking point that appetite start to get weak. Then ST36 energy enhancer is always the savior.
Add energy enhancer.
So yeah, ST36. Normally I see immunotherapy, right? 5-6 months later, right? Initially they looks good, because immunotherapy is not as intrusive like chemo and radio.
Right.
So the side effect will kick in a few months later. So now they feel good, but 5-6 months later, slowly the appetite is get weaker. Then we add on with energy enhancer ST36.
Oh, you're saying SP6?
ST36, the acupuncture point below the knee cap.
Oh, okay. SP6, EE on SP6.
Energy enhancer at ST36.
Okay.
Yeah.
I thought I heard wrongly. I thought you meant use SP6.
Yeah, ST36 at the ST36 acupuncture point.
Okay. Can.
Okay, take care.
Thanks a lot. Thank you.
Welcome. Amazing, right? Wow, so you are able to help someone who can walk without the cane. You are able to help someone undergo the cancer therapy, and the doctor was impressed with the result during immunotherapy. So just to answer the earlier question, can they use during chemo and radio? I would say go ahead. Last time I used not to encourage people to use the patch, only use Eon, not X39. But a lot of cancer patients that they came to me and said, Jinlong, you have to let people to use X39 during the chemo, because I myself, I'm doing chemo. It was so depressed when I was doing chemotherapy because I'm so tired. I got brain fog. I got no appetite, right? So when I started to use the Eon, I can sleep better. Appetite get a little bit better, but the energy is still not very good. But when I put X39 and Eon together, wow, I tell you, everyone look at me like I'm not like a cancer patient. I suddenly become much more energetic. I become more positive. That I have new hope for the next stage of my life. So then after that I said, okay, then we are going to talk about S39 even during chemotherapy. Okay. So but if someone is doing chemotherapy and you only introduce, you don't push, because anything happen, the blame always lies on you. Okay, the blame always lies on you. So I repeat the sequence like what Sim asked me. In any treatment of cancer, X39 Eon, no problem. Continue. What we see is always the energy will maintain, the appetite will maintain. Okay, normally 100% of the time they will look like normal person, but they will come to the time that their appetite start to become bad. That ST36 below the kneecap energy enhancer is very useful to jack up the qi to improve your appetite so that you want to eat. This is very important. Okay, if all these things have been done already, everything doing well, then the patches that I recommend is Alavida. So why I start to talk about Alavida rather than glutathione is to detox, right? Carnosine is for the eye. Why I talk about Alavida is Alavida is a very holistic product that really target many parts of the body and organs. It's just that we label Alavida in the skin condition. But if you think about this, right, if it can improve skin condition, it can improve collagen, it means that it also make your blood vessel, your soft tissue, your organ to become better also. So in one of the very early Zoom of David Smith, right, David Smith have mentioned before that X39 and Alavida is, for him, is the best combination few years ago. Now it's X39, but last time it's X39 Alavida. And he said if there's one thing that he want to recommend at night is Alavida. But of course now he has said that Eon is better. But that means the third product I want to anchor is on Alavida. So go ahead to try Alavida. even you are perfectly fine. If you don't know what patch to use after X30 and Eon, okay, your appetite is good, everything is going good with you, then I would say start on with the skincare, start on with the Alavida.